Next, we're going to look at the nephron. I'm just going to go over more the anatomy and I'll mention where some drugs work, but we're not doing in detail everything about the nephron. That's more physiology and I'm more into the anatomy side. So to start with, we've drawn the nephron. So here you have the Bowman's capsule, and then you have the proximal convoluted tubule. And then this is the loop of Henle. This is your distal convoluted tubule. Here's your macula densa. This is your collecting duct. And then we're going to draw in some arteries now. So we'll start with the renal artery, and then you have the afferent arteriole that goes to the juxtaglomerular apparatus. And then the efferent arteriole runs around. Now this artery pretty much loops all the way down and forms networks across the loop of Henle. And then for venous drainage, this is a capillary network, so obviously they don't just go red to blue, but in the image it just makes it easier. Then the vein goes back to the renal vein, which then goes to the IVC, the inferior vena cava. So this is the renal artery from the aorta. So that's the kind of basic blood supply of the nephron. And then we'll have a look at the osmolarity. So blood's filtered here at Bowman's capsule, and then you have an osmolarity of about 290. And then as you go down the loop of Henle, it gets more and more concentrated. So you can go up to about 1200. And then here, sodium chloride's pulled out and it gets more dilute as you go up. And then it enters the collecting duct. And then once again, it becomes around 800 and 600, and then it becomes more concentrated as it passes to the renal pelvis. So that's the kidney's job really, is to remove any waste products. So if we look at what drugs work where, so in the proximal convoluted tube, you have carbonic anhydrase inhibitors. And then in the loop of Henle, you get loop diuretics. That's quite easy to remember, being as it's called a loop diuretic. It's normally in the thick ascending loop and early distal convoluted tubule that the loop diuretics work. So thiazide diuretics work in the early distal convoluted tubule, so just here. And then later you have the potassium sparing diuretics, and they work in the distal convoluted tubule. And then your aldosterone antagonist works in the distal convoluted tubule and in the collecting duct.